Okay, we're doing really well here in terms of time. So let's move on and talk about some skin disorders and how we treat some of them. Okay. Okay, so we're gonna move on and talk about some skin rashes and disorders. One of the main ones that we're going to concentrate on is one called psoriasis, which is an autoimmune skin condition where there's excessive keratin production and really rapid cellular turnover within the tissue of the rash. Okay, so I mean these lesions can be anywhere in the body. Typically, think of psoriasis as these kind of stuck-on plaques with a silvery surface to them where the keratin is. And they're often on the extensor surfaces of the joints. So the back of your elbows, um, the front of the knees, because those are the extensor surfaces. The scalp is a common area within your hair. And they can be on the trunk. They can be on the back. They can be on the front. They can be on your lower back. So all over. But also think of those extensor surfaces because those are really common places to get them. Okay. I wouldn't spend too much time trying to memorize the different types of psoriasis, psoriasis vulgaris and exfoliative, or pustulosis. I mean, they're all just varieties of psoriasis. Okay. Now, another condition that occurs with the skin condition is psoriatic arthritis, right? So not only do you get these silvery plaques on different areas of your body. Um, there's psoriatic arthritis, which is an inflammatory arthritis of the joints. Okay, so just like rheumatoid arthritis is an inflammatory arthritis, the arthritis you get with systemic lupus, well, psoriatic arthritis is also inflammatory. So you get joint swelling, joint stiffness, and remember, associated with psoriasis is pitting of the nails. Now, psoriasis is a chronic skin condition, and it can be flared up uh, by by certain conditions. So, for example, if you have an infection, that could flare up your psoriasis. If you've had an injury to the skin, you can actually form a plaque there, which is very strange, right? So trauma to the skin can create a plaque at that area. There's definitely a inherited component to this, so there's genetics involved, since patients often have other families with psoriasis. It can be flared up by stressors, emotional stress, typically in the summer, psoriasis is better. Why? Because of the UV light. Hormones can flare it up. So puberty, menopause can flare up psoriasis. And there's certain medications that can flare up psoriasis as well. Okay. All right, we'll come back to it. Dermatitis. This term is really just a grab bag term of all kinds of rashes because dermatitis just means inflammation of the skin. So it's a very general term. If I said to someone, you have dermatitis, that's not going to tell them, other than telling them there's something wrong with their skin, it's not going to tell them what the problem is. It just means inflammation of the skin. Okay? So we're going to talk about a bit about atopic dermatitis, which is another term for eczema, which is a very uh, dry, scaly, itchy rash that typically children get. Contact dermatitis means something has come in contact with your skin and caused the rash. And it can be an allergic contact dermatitis, meaning whatever touched your skin you were allergic to, and that's why you have um, the inflammation of your skin, or irritant contact dermatitis, meaning a chemical touched your skin and it's caused a dermatitis. Okay, so those are just two different types. Seborrheic dermatitis Think of dandruff, kind of a flaking, dry skin from the scalp. You can get seborrhea in your eyebrows. Again, flaky, dry skin coming from your eyebrows. You can get seborrhea in the folds of your nose, in the corners. And you'll see patients with seborrhea there too. So those are common areas to get seborrhea. Infectious rashes, well, we'll talk about some bacterial ones, viral rashes, fungal, and then we'll get into some infestations, lice, and scabies. Okay? Talking a bit about pressure ulcers and the stages of pressure ulcers and how we treat them. And then finally, and luckily, uncommon rashes, Stevens-Johnson syndrome, and a more severe form of Stevens-Johnson syndrome called toxic epidermal necrolysis, or TENS. Okay. Okay, so pruritus. So most of us have experienced itchy skin, and that's exactly what pruritus is, just itchy skin. It's not telling you the cause at all. Okay. And it can be anything external that's contact to the skin, or conditions that are internal to the body. Okay, so sometimes it's hard to figure out at the beginning, but certainly conditions that are affecting the skin, such as chickenpox, eczema, that we'll talk about, which is a really dry, scaly, fissured rash that can cause severe itching. Okay, psoriasis can cause some itching because of the plaques it forms. Medications, in particular, courses of antibiotics can lead to urticaria, which is the rash that can develop with an allergy to an antibiotic, and itchy skin. Okay. Soaps, chemicals, fragrances that can irritate the skin and lead to pruritus. Soaps, in fact, can lead to very dry skin because they take the natural oils away from the skin. Radiation therapy can certainly, for cancers, can certainly cause itchy skin. Heat, some people are sensitive to heat, so when they get in the bathtub, that can create itchy skin because certain people release histamine in the setting of heat in their skin, and it leads to pruritus. Stressors, psychological stressors, can cause itchy skin. In terms of internal conditions, the two organs I really think of is kidney disease with its buildup of toxins, and liver disease with buildup of bilirubin and deposit in the skin. Both lead to itchy skin. Okay. Pregnancy is another one. Pregnant women often complain of itchy skin, especially in the third trimester. We think it's just reduced flow of bile in the liver, and that can cause a bit of a buildup in the skin, leading to itchy skin. Okay, so pregnancy-induced urticaria or pregnancy-induced pruritus. Okay. So let's move on from here. Okay, so let's talk a bit about pressure ulcers and just recognizing the stage of pressure ulcers, right? So, at the beginning, a pressure ulcer may just be a bruise, right? Just be a bruise over an area where there's there's a bony prominence, such as the hip, in a thin person, or on the coccyx or the lower sacrum. Very thin areas where there's pressure if people aren't moving, right? The back of the heels can be another area if someone's lying in bed and not moving. So think of the common areas: the heels, the coccyx, the sacrum. If they're lying on their side, maybe a hip. Those are common areas, okay? And you can just have discolored skin at the beginning. So a stage 1 ulcer is where the skin's still intact, but it's inflamed, right? Non-blanchable redness means that there's a bit of blood outside of the tissue, right? If it was blanchable, it would still be in the blood vessels. Okay. Stage 2 is, yep, there's been some skin breakdown, and there's partial loss of the dermis with a very, very shallow ulcer, and we'll see an image of that. So it still looks pink, and it's the beginning of uh, of an open skin ulcer. Stage 3, full thickness, right? So it's now through the dermis, and it's deeper. It's into the subcutaneous fat. Okay, so more serious. And then finally, a stage 4 ulcer where we can now see tendons or bone below or muscle that's below the subcutaneous fat. Okay. Okay, so just classify those in your mind. Okay, stage 1, intact skin, non-blanchable, meaning there's bruising there. Stage 2, yep, skin's open, it's into the dermis a bit, looks good, pink color, which is always reassuring. Stage 3, deeper, right through the dermis into the subcutaneous fat below the dermis. Stage 4, down to the bone or the tendon or the muscle that's below the area. Okay. And unstageable means it's full thickness, but there's a lot of tissue in the ulcer that we just can't tell what's going on below it, or there's clotted blood or scab in the bottom of the wound. Okay, so these are just some practice images of ulcers, and again, they're usually on pressure points, right? Heel, coccyx, sacrum, hip. Okay, so stage 1, or sorry, number 1 is a stage 4 ulcer. Okay, it's deep, it's through the subcutaneous tissue, and it's exposing either a tendon or a muscle or a bone. Okay. Number 2 is really just a deep pressure injury, right? There's bruising there, and that would be non-blanchable, by the way. Okay, so that's bruising in the tissue. It's outside of the blood vessels. Okay. Stage 3, number 3 is likely a stage 4 ulcer, but you can't tell. It's not stageable because there's clotted blood within the wound, so it's very hard to see the base of the wound, right? Number 4, that would be a stage 3 ulcer. So it's through it's definitely through the epidermis, through the dermis, and into the subdermal area and fat tissue. Okay, so stage 3. Stage 1, so you can see there's intact skin. There's no bruising. It's just inflamed red skin. So nothing's opened up yet. 6 is another one that you really couldn't stage because of all that granulation tissue and collagen formation on the ulcer, and maybe there's even some infection under there. And 7 is a perfect example of a stage 2 ulcer, right? So the skin's broken down, very shallow ulcer with redness. It's got a good color. It's pink. Right? Doesn't look infected. So how do we manage a pressure sore? Well, get the pressure off it, right? That's number 1. You have to get the pressure off the area, whether it's a hip, sacrum, heel. That's number 1. Get the pressure off. Otherwise, it's just going to progress. With open wounds, closed wounds don't need irrigating, right? So if it's just erythema, then it doesn't need irrigating. Sterile solutions, so sterile water, sterile saline, just to remove any debris or anything that's within the wound itself, and keeping it clean, right? Now we don't irrigate with antiseptics. We don't pour chlorhexidine or alcohol into there. Those liquids destroy normal healing cells. So sure, you might flush out some bacteria, but you're actually destroying normal healing cells. And that would definitely delay wound healing. Okay, so it's saline or water that's instilled and flushed the wound with. What are factors that can delay healing? Well, if you have poor tissue perfusion, why would you have that? Well, what if you have atherosclerosis and a blocked artery to the wound, to the leg? Well, that's a problem, right? You're going to get less blood supply there. What if you have diabetes and you have some blocked blood vessels and capillaries and poor wound healing? Yep, definitely. Diabetes with pressure sores, that's not a good combination. What if you're hypoxic? Like you have COPD and you have poor oxygenation in your bloodstream. Well, oxygen is not going to get there. It's going to heal poorly. What if your leg is really swollen and full of edema, and the blood can't get to the wound very well because there's so much fluid to travel through? That would be another issue. Okay. Poor nutritional status. So your diet is really poor, or you're chronically unwell and you don't have a good nutritional status. Poor hygiene to the wound for sure, because it's going to get infected. And of course, continued pressure. Okay, so just think of all those things that can impact a wound from healing.